Good afternoon, everyone. Thank you so much for joining us for the Cleveland Clinic virtual information session, Transform Your Skin with Exfoliation, the key to healthy, glowing skin. My name is Brianna Clare, and I am the Department Administrator of Dermatology, and I will be your host this afternoon. I'd like to quickly go through and read our disclaimer just to let you know how our session will operate today. And then just before I do that, a few housekeeping rules. I will need everyone to remain muted throughout the session. This way we won't have any interruptions when our esthetician and speaker for this afternoon begins talking. So please, please, please keep your phone on mute throughout the information session. Thank you. Additionally, if you have any questions and you are online, you are more than welcome to enter your questions into the chat, and we'll have a quick Q&A at the end of the session. This session is a voluntary opportunity to receive educational information from a Cleveland Clinic provider and ask general questions. Please note that this will be in a group setting with other individuals in attendance. Any information that you share, including your name or any personal information that you provide when entering the session, your phone number if you choose to dial in to the meeting by phone, and any questions that you ask or submit may be visible to all other individuals who choose to participate in the session. By participating in the session, you agree to respect the privacy of other participants by not discussing or otherwise sharing their names or other personal or medical information that they may share during this session. It is also important to note that the session is intended to provide general information for educational purposes only, and medical information provided in response to another individual's questions may not be appropriate for all participants. If you would like to schedule a visit to discuss your specific medical concerns or symptoms, please contact your Cleveland Clinic provider. All right, now, without further ado, I will go ahead and introduce our speaker for this afternoon. We have Stephanie Diliberto, an esthetician here. Stephanie is a licensed esthetician who graduated from the Brown Aveda Institute in Mentor. She is also a veteran of the U.S. Navy with a bachelor's degree in communications from Cleveland State University. While working as an account executive for a cosmetic line, Stephanie developed a passion for skincare and helping others to gain the confidence that comes with healthy skin. She enjoys learning about the latest skincare products and technology and helping to provide personalized solutions to patient-specific skincare issues. And so today we will hear from our expert, Stephanie Diliberto. Without further ado, go ahead.
Thank you. Good afternoon, everybody. My name is Stephanie, and thank you so much for joining me and spending time out of your day to learn more about exfoliation, the key to healthy, glowing skin. Today, we are going to talk about the process of exfoliation, how exfoliation is beneficial to the skin, the types of exfoliation, and what works best for your skin type. We are also going to discuss what products you can use at home to exfoliate with and the different aesthetic services and treatments that we provide here at the Cleveland Clinic to keep your skin healthy and looking radiant for the holidays. What is exfoliation? Exfoliation is the process of scrubbing away dead skin cells that gather on the upmost layer of your skin. An important part of keeping a healthy skin routine, it sloughs away dead skin cells and reveals skin that is much brighter, radiant, and healthy looking. The very top layer of the skin, the stratum corneum, is made up of 10 to 30 layers of dead skin cells. These skin cells are constantly sliding off and being replaced with new ones. As we age, the cell turnover process slows, and exfoliation can speed up that cell turnover process. It leaves the skin looking brighter and improves the effectiveness of topical skincare products by enhancing absorption. The key benefits of exfoliation: it helps prevent clogged pores, resulting in fewer breakouts. Unclogged pores help prevent blackheads, whiteheads, and acne. It minimizes pore size and superficial scars, evening skin tone, which helps fade dark spots by removing dead skin cells containing pigment. It promotes skin elasticity, making fine lines and wrinkles look less visible. It allows for better absorption of moisturizers, antioxidants, and anti-aging serums, Long-term exfoliation can increase collagen production. Okay, there are two methods you can use to exfoliate your skin: chemical exfoliation and physical exfoliation. Chemical exfoliants. This method uses chemicals. They are solutions that are slightly more acidic than the skin. There are two types of chemical exfoliants: alpha hydroxy acid and beta hydroxy acid. These acids help break down dead skin on the surface layer. Most commonly referred to as AHA and BHAs, this form of chemical exfoliation can produce more dramatic results by combining the structural lipids in the outmost layer of the skin, dissolving them so the dead skin cells break away. AHAs are water-soluble, derived from natural sources such as fruit, milk, and sugar. Two of the most widely used AHAs are glycolic and lactic acid. BHAs are oil-soluble that go deep in your hair follicles to dry out excessive oils and dead skin cells to unclog pores. The most common BHA is salicylic acid. Glycolic acid, the smallest of the alpha hydroxy acid compound, it's made from sugarcane. It is used to improve the skin's appearance and texture. It may reduce wrinkles, acne scarring, and hyperpigmentation. Okay, the next chemical exfoliation is lactic acid. Lactic acid derived from milk. It is used to treat hyperpigmentation, age spots, improve skin tone, and pore appearance to give the skin a less dull and more even complexion. Lactic acid is a better choice for more sensitive skin as it has a larger molecule than glycolic acid, which can make it gentle enough for inflamed conditions such as rosacea and eczema. Salicylic acid is a BHA derived from willow bark. It works as an antibacterial agent by causing the top skin cells to shed more readily, opening clogged pores and neutralizing bacteria within, preventing pores from clogging and making room for new cell growth. Salicylic acid reduces oil production and are effective for acne-prone skin and helps unclog larger pores. Physical exfoliation, or it can be described as manual or mechanical exfoliation, is a method that requires a manual scrubbing or using tiny grains to physically scrub debris. Using these scrubs in a massage motion stimulates blood circulation and helps break down toxins and reduces puffiness. Examples to choose for manual exfoliation are cleansing scrubs, exfoliation mitts, dry brushes, loofahs, derma rollers. If you choose to exfoliate with this route, pay attention to the ingredients and how often you are using this method, as you can over-exfoliate and it can be harsh on the skin. If you feel irritation or see redness in the skin after mechanical exfoliation, you could be overdoing it. If so, then slow down how often you exfoliate. A big staple in the beauty aisle is retinols. Retinol is a form of vitamin A and has gained popularity in the skincare market due to its beneficial effects on acne and anti-aging. This multitasking ingredient provides aging support and overall skin rejuvenation. From breakouts to sun damage, retinol can address a variety of skin concerns. Retinol boosts collagen production, increases cell turnover, and regulates oil production. Rather than removing dead skin cells as other exfoliating products do, the small molecules that make up a retinol go deep beneath the outer layer of the skin and boost the production of collagen and elastin. This creates a plumping to the skin and helps reduce the appearance of dullness and fine lines. The benefits of using a retinol: it reduces the signs of aging. Your skin will look more youthful. It addresses fine lines, wrinkles, sun damage, uneven skin texture, and large pores. Retinols can help strengthen the skin and help prevent and protect the skin from further damage. To achieve the best result from a retinol product, you must use it with consistency. These side effects should subside within a few weeks to a month of use. People who use retinols most commonly experience dry, itchy, and irritated skin. It is important to build up your skin's tolerance to retinols. I recommend first-time retinol users to apply every other day or every 2 days and build up your skin's tolerance before moving to daily use. It is common to have the side effects of mild irritation, and you just have to give your skin some time to adjust. Retinol is not recommended for women who are planning to be pregnant, are pregnant, or nursing. Patients who have eczema or rosacea should consult a dermatologist before use. It is crucial to use an SPF 30 every day and apply every 2 hours if you are using any products containing a retinol, and avoid direct sun exposure as much as possible. What type of exfoliation works best for you? Now that you're familiar with the similarities and differences between a mechanical exfoliation and chemical exfoliation, what does that mean for your skin type? If you have sensitive skin, lactic acid is one of the most gentle and hydrating acids. Be cautious using a mechanical exfoliant, as you can overscrub and make the skin feel more sensitive, especially if your skin responds after exfoliating or become red and blotchy. Start with once a week, and you can slowly increase the frequency if your skin is tolerating the treatment. If you have dry skin and your skin feels flaky or rough, glycolic acid or lactic acid can break through the surface layer of your skin, allowing moisturizer to hydrate new skin cells. It is important to use nourishing and hydrating serums and moisturizers after exfoliation to keep the skin soothing. And of course, sun protection is also very important. If your skin is a normal or combination type, normal skin is clear and not irritated. Many people who have normal skin can use any exfoliating type or product without any irritation or side effects. Normal skin types have the option to use chemical or mechanical exfoliation properties. If you have combination skin, this means you are oily in some spots of your face more than others. You can use certain scrubs on oily areas of the face one day and use products that have a low level alpha hydroxy acid, such as glycolic, on normal areas the next day. Normal combination skin types have more options of exfoliation treatments. If you are oily and acne prone, those with oil and acne prone skin types are able to use stronger chemical and mechanical exfoliants such as glycolic acid or face scrubs. If your skin is acne prone to breakouts, salicylic acid is a great option to keep your pores clear. Exfoliating at home. For extremely sensitive skin and at-home exfoliation, I recommend to look for face exfoliants that are enzyme-based. Enzyme-based exfoliants come from natural sources like fruits, and it allows for an extremely safe and gentle exfoliation process. Examples of enzyme products are papaya, jojoba beads, seeds, and crushed nutshells. Exfoliating with a gentle scrub, sponge, or face brush, gently apply your product using circular motions for about 30 seconds. Begin with your nose and work your way outward to reach your temples and move across your cheeks and jawline. Rinse off with lukewarm water and gently pat dry. Do not exfoliate open cuts or sunburned skin. Apply a serum afterwards to bring your skin back to its normal pH level and finish with a moisturizer and SPF. The Aesthetics Corner has many options to choose from cleansers, treatment serums, moisturizers, and SPFs suitable for your skin type and skincare needs. It's important when exfoliating to consider the products you already use. For example, if you are using a retinol serum, you want to make sure you space out the time you are exfoliating with the retinol in your routine. Also, find the exfoliating regimen that works best for you. Start slow, once or twice a week, and wait 3 to 4 weeks to see how your skin answers to the regimen. Remember, it takes your skin a full cell cycle, about 30 days or so, for your skin cells to turn over so give your skin time to adjust. If you are feeling irritation or redness, slowly ease off on how often you're exfoliating. Consult a dermatologist if you experience excessive irritation. We here at the Cleveland Clinic have estheticians on hand to address your biggest skin concerns and help guide you to a skin regimen that is right for you. We provide many effective skincare treatments to cater to your skin needs. Our skin experts offer procedures that provide professional exfoliation with minimal downtime. One of our most common procedures is dermablading. Dermablading is a gentle exfoliation treatment that helps remove dead skin cells and peach fuzz. A dermablading tool is used to get closer to the skin for optimal exfoliation, taking off the top layer of dead skin cells, and helps skincare products and further exfoliation treatments to work better. This treatment prevents dead skin from being trapped inside the follicle. Makeup is applied smoother on the face with regular dermablading treatments. Dermablading is suitable for most skin types except for acne and inflammatory skin conditions. Microdermabrasion. Microdermabrasion is a minimally invasive procedure to renew overall skin appearance and texture. Used with a special applicator and a suction on the skin, it rejuvenates the skin by exfoliating dead skin cells. This procedure has minimal downtime and the skin looks brighter and more even skin toned. The Diamond Glow. The Diamond Glow is a 3-in-1 resurfacing technology. The Diamond Glow uses a handheld wand with different tips that is customized for your skin concerns. It exfoliates, extracts clogged pores, and infuses treatment serums catered for your skin type. With no downtime, the skin feels clean, refreshed, and awakened after just one treatment. Chemical peels. Using a solution to remove layers of dead skin, it can improve the appearance of fine lines, wrinkles, and discoloration. We have multiple options of superficial chemical peels to choose from depending on your skin type and concerns. From glycolic, lactic, to salicylic acid. We also provide the Skin Medica Peel series, the Perfect Derma Peel, and lightweight peel treatments for your neck and chest, hands, and eyes and lips. The Hydrofacial. The Hydrofacial combines cleansing, exfoliation, extraction, hydration, and antioxidants to improve the appearance of fine lines and wrinkles, congested pores, and hyperpigmentation, even skin tone and texture. It helps loosen dead skin cells and debris while hydrating the skin. This completes my presentation. Does anyone have any questions?
Thank you so much, Stephanie. We really appreciate that insight into exfoliation, and I hope you all enjoyed and got some good tips and tricks for at home, as well as coming in to see one of our expert estheticians. Now, if you have any questions, I do ask that you enter them into the chat if you're able to do so, and then I can read them off for you. We'll give it just a few moments to see if anyone has any to enter in the chat, and then if not, we may give an opportunity to come off of mute, but I think the best way is to go through the chat. So we do have one that just came in. So our first question is, should exfoliation be done regularly anywhere besides the face? And that's a great question.
Yeah, you can exfoliate anywhere. You can exfoliate your back. A lot of people get back acne or your chest. Yeah, you can exfoliate anywhere. Just again, be careful about overdoing it. So a lot of people get the back acne. A lot of people who work out or sweat a lot and things, they get a lot of clogged pores in their back. So we do provide a salicylic back treatment. If you're interested, we'd love to see you.
All right. Great question. So we have another question. Is hyaluronic acid an HAA or a BHA?
Hyaluronic acid is neither. AHAs and BHAs are chemicals that break down the skin. Hyaluronic acid is, your body produces hyaluronic acid, and it's very hydrating. It's highly recommended to use in any skin regimen, especially with the cold winter months. We have quite a few hyaluronic acid serums in the aesthetics corner if you need some further recommendations. But hyaluronic acid is gentle, safe, hydrating. It's a beautiful, amazing product. It's like water. You can use it twice a day if you want.
All right, great. Thank you for that clarification. I'm learning quite a few things. So another question is, what is the difference between retin A and retinol?
Okay. Retin A is a form of vitamin A and is a prescription medication from a dermatologist. Retinol is readily available in multiple skin products. Retinol is derived from retin A but does not require a prescription. It is less strong as a retin A and a great option for beginners looking to try it out. Remember, always slowly ease your way with retinols. And if you're pregnant or breastfeeding, you cannot use any form of retin A or retinol. A lot of people use retin A or retinols and they feel dry, they feel itchy, you just have to work your way through it and your skin will adjust to it and the results are amazing.
Awesome. So we have a clarifying question along with that.
Sure.
So retinoid, is that the same as retinol?
It's all of them. It's everything.
So retinoid means it's including all of the different retin A and retinol. Okay, so that retinoid is just a larger group of the retin A and retinol. All right, so I'm going to jump back really quickly just to make sure I get all the questions. So would you recommend exfoliating at night or in the morning?
I recommend exfoliating at night, and just be cautious of what you're using. A lot of products in your skin routine could have exfoliation properties in it that you might be using during the day or in your cleanser. But I recommend a lot of, just like retinols and retin A's, night. I personally prefer to exfoliate at night. If you're going to exfoliate, make sure you're not using, like I said, be cautious about other things you're using in your skincare routine, like glycolic acid or retin A's or retinols and things like that. You want to make sure you spread those out because you can overdo it.
All right, so we also have a great question. How do we schedule a consult to decide what is best for the face, and is there a charge for that?
Okay, so we have a slide for you. It's our aesthetic services brochure. And attached is our scheduling phone numbers, our services that we provide. There is a $35 skin evaluation charge. If you purchase a product in our store, the charge is waived. And they can contact those phone numbers above on the slide to schedule an appointment with an esthetician.
Perfect. So we're going to keep going with the questions that we have. Is there any part of our skin that ages at accelerated rates? So yeah, does any part of our skin age faster? And is there any separate recommendations for these areas of skin?
So under the eyes, thinner, then the face and the neck. So we do have neck creams that you can start purchasing proactively, and we do have different eye creams that you can start using, can help. We also have a neck lightweight superficial peel, a neck and chest that helps with kind of like crepey concerns on the neck. Also the chest, if there's like some sunspots, things like that. A lot of patients that come back for those treatments, and I see good results. We also have the eye peel that is a nice lightweight eye treatment that helps brighten under the eye area, helps with the puffiness and the fine lines and dark circles.
Perfect, thank you. And so, I experienced this as well all winter. So if I'm feeling a little sensitive in the winter and I exfoliate daily, how do I know if I'm over-exfoliating? If you did recommend, make sure we don't do that. And then how do you recommend that I calm if I am over-exfoliating?
So thank you for the question. There are a few telltale signs you're overdoing the exfoliation in your routine. If you're irritated, having a little redness, inflammation in the skin, Your skin can become dry and flaky. You can also have breakouts and become red and blotchy in certain areas. Ways to recover from overexfoliation would be to stop retinol products, just stop exfoliating all chemical exfoliators, switch to a mild, gentle cleanser, and if you're kind of irritated in those areas, you can put on an Aquaphor, or that's a nice moisturizer in those areas. Once your skin is healed, less sensitive, you can slowly introduce exfoliation back into your routine. I would only start with once a week. After a few weeks, if your skin is tolerating, then you can increase to twice a week.
Got it. All right. Well, again, thank you so much, Stephanie, for these wonderful tips and tricks. I hope you all found them as helpful as I did. We hope that you all come to visit our estheticians in the store, and we hope you have a great rest of your afternoon.